Hi, my name is Paula Brown. We're going to be doing a video today on assessing the abdomen. My patient here is Mr. Griffey, and what you're going to do first when you assess somebody's abdomen is you're going to have them lie in a supine position with their arms down to their side, a pillow underneath their head. So when I inspect, which will be the first thing that I do, is I'm going to inspect for the characteristics of the stomach. I'm going to inspect the symmetry, look for any surface movement. Everything seems to be fine. I can certainly see when he's breathing. So once we get done with inspecting the abdomen, we're going to auscultate. So that means we're going to take a listen to things. And I'm going to go ahead and listen to his bowel sounds in all 4 quadrants. Okay, and his bowel sounds were normal. There was a gurgling tone in there, which means that there is some good peristalsis. One thing that we want to listen for when we auscultate the tummy is we want to listen to the aorta artery here. And that runs right midline, and then we'll branch off to the left and the right iliac artery. So let's take a listen to that. Okay, good. One thing that we don't want to hear, we don't want to hear any bruise. That is a whooshing sound made by some type of narrow blood flow that would raise suspicion as to maybe we might be dealing with an aneurysm. So we certainly would look further into that if that was in fact the case of what I heard today, but everything was normal. When we do listen to the bowel sounds, we are listening, normal bowel sounds are anywhere from 5 to 15 a minute. So if we sat and listened to a full minute, I'm sure that Mr. Griffey would fit that. You have normal bowel movements, Mr. Griffey? Yes. Okay. Okay, so once we get done with the auscultation, we're going to percuss. And I'm going to go ahead and percuss all 4 of the quadrants in his abdomen here. We know that when we percuss, tympani is going to be over a hollow organ, and then when we have organs that are solid, we're going to have a dullness. So let's go ahead and okay. So when we percussed the abdomen, we wanted to make sure that we did hear those tones. We're going to percuss the liver, and the way that we're going to do that is we're going to start right about here in the 5th intercostal space, and we're going to work our way. So as soon as I hear the tone changing, I'm going to go ahead and mark his belly. Okay. And then I'm going to go ahead and measure it, and we're right at about 6 centimeters, which is fine. And one thing that I'm going to have you do while you're laying here, Mr. Griffey, we're going to move into palpating the abdomen. I'm just, as I've been touching his stomach, I just wanted him to get a feel for my hands, and at the same time, I'm feeling for any bulges or masses or anything like that. I look around the umbilical ring and make sure that there's no bulges or masses there. So when we get into palpating, a deeper palpation, we can go ahead and palpate. The liver, and in doing so, I'm going to feel for the liver. Mr. Griffey, I want you to take a breath in, and then I want you to blow it out. So take a breath in, blow it out, please. And if we palpate the liver, we can feel it graze past our fingers as he blows out that breath of air. And then we have deeper palpation, which we can palpate the gallbladder. In a normal adult, unless the spleen is enlarged, you're probably not going to be able to palpate that spleen. So I'm going to just put my hand underneath his back here as I try to feel for his kidneys and palpate those. And of course, depending on the weight of the individual, you're going to want to make sure that you palpate deep enough. Okay. All right. So that concludes that portion. Now I'm going to have Mr. Griffey sit up on the side of the bed, and I'm going to check for any kidney tenderness. So sit up here on the side of the bed for me. Can you move forward just a smidge? There you go. Good. So I'm going to go right below the 12th rib and right in that hollow spot. And I'm just going to, any pain, Mr.
No.
Griffey? Any pain?
No.
Okay. So no pain when I percuss the kidneys. So that is going to conclude our video today on the abdomen. Thank you for joining us.